if you miss something, please feel free to write it in the text. Or if you want to, you can even view it online a little bit later. What I've also done is I've uploaded this particular mind map on the web server, in actual fact. I'll show you now how to get that, because we've actually developed a new website now. You can download lots of little goodies, including these sort of things on there as well, and we're constantly adding to it too. Okay, so what I'm going to do, let me start this off. Let's just click that and that and that. That's big, isn't it? Like that. Okay. Today, the reason why I decided to do this webinar is this particular topic, and I'm just going to clear up my desktop a little bit now. Here we are. The reason why I decided to do this particular topic was there's been a lot of controversy about high-risk meds and over-the-counter, and especially, say in a sense, unsupervised sales of such. So, for example, there was a recent article in the BBC with regards to laxatives and how various supermarkets, including Boots in actual fact, I never mentioned in the article, sold multiple packs of laxatives without any checks. And I've got the article here now. I'm going to click on this, all right, and this actually will hopefully, if everything goes well, bring up the article itself. Here we are. So this is the article itself. So the link to this is going to be posted on the website again as well. It's on the mind map, so you don't need to write this down or anything. But as you can see here, this particular article was written on the 16th of October. That was probably about a couple of weeks ago now, actually. And you can see that if you look through it, Beat estimates that 80% of those affected by eating disorders in the UK have misused laxatives in order to lose weight. If you go further down, you'll actually see that there are a number of reasons why you don't want to abuse these things. So, for example, it says here, it can lead to diarrhea, dehydration, electrolyte imbalances, kidney failure, a whole number of different things. And it's your job as counter staff and also as pharmacists. There are a few pharmacists here on here today as well. Is to establish whether or not a person buying laxatives is using it for the right reason. It's not just laxatives, but there are other medicines as well. If you go down, we've seen a 30% increase in calls to helplines in the last year where people have mentioned overusing laxatives. It's quite a serious thing. So it's not just about laxatives, it's about other medicines as well. There are also now arguments to put laxatives on something called the pharmacy-only list. Although whether or not people think that's appropriate is questionable. I don't know. I mean, I would personally do it, but there may be others out there who do not want that to happen. So these laxatives in particular as well are taken over the counter. In other words, that you don't even need to have it behind the counter. You can actually have it on the sales floor. And hence one of the reasons why it's so difficult to police this. As I said, this has come up as as quite a serious topic recently, and hence the reason why I decided to do something like this. So that's an article which you can read up, and we'll in actual fact, what I'll do, let me forward you the link on here, seeing you lot are here. Bear with me a second. You have it on here now. I'll put it into the chat box for everybody. All right, give me 1 second. There you go. All right, so you got that link for you to have a look at. Now, this is quite a short webinar, and the reason why it's going to be reasonably short is because I want you to remember as much as possible on it. If I keep on droning on, you're not going to remember much. Now, this bit here, the types of medication you'd want to consider. So let's say, for example, a patient comes in and says, I want this type of medication. Your alarm bell should immediately be ringing, thinking, okay, have I met this person before? Are they taking it on a regular basis? Are they likely to misuse this particular medicine? And there are really good articles, which I will show you, a good paper, which I will put in the chat box again for you to to read at your leisure. Let me just do now. There you go. All right. This is 2013, and it was published in the Journal of Substance Misuse, and it's a very relevant paper, over-the-counter medicine of abuse, a review of literature. And in this particular paper, it mentioned 5 different types of medication that can be bought quite easily over the counter that you need to be particularly careful of when you give it to certain people. Okay. Sorry, some trouble audio. Just bear with me 1 second. Now, earlier on with somebody, and everybody else was okay with this. And can you hear now? Okay. Right, okay, until I get a response. Okay, let's move on with this. Okay. The types. This was the paper that you need to take into account. So, I forwarded on the link to this. What you have at the moment is you have in this particular paper, there's 5 different groups of medication you need to take into account. All right, so you can read it here. Okay, what I've done here is I've actually broken it down for you as well. So the types of medication that actually brought up is these particular products here. So you've got codeine-based medicines, you've got cough products, sedative antihistamines, decongestants, and laxatives. You will all be familiar as counter staff on this particular on these particular types of medication, but this particular paper is really good because it summarizes it all into one nice little package for you. So let's have a look at the codeine-based ones. We would want to think about are killers, which are quite obvious. Things like Nurofen Plus, paracetamol, and codeine. And there is one which is not quite codeine, but it's codeine-based or similar to codeine, called dihydrocodeine, and that's in Paramol. So with codeine inside it, your alarm bells should be ringing. A codeine-based cough suppressant, and we'll talk about cough products in a minute as well. But this is again one which you need to take into account as well. Finally, there is something called kaolin and morphine. Morphine is a medication which is very similar in its nature to codeine as well. These are the codeine-based products, and there are others as well. There's Panadol Ultra, but anything really with codeine inside it, your alarm bells should really be being alert. All right. So that's the first one. The space products. So you've got a variety of different cough medicines. The one, dextromethorphan in it. Okay. This one is the one where a lot of people can tend to use. Now, if somebody needs a cough product on a regular basis or reasonably regular basis, it could be that they have a very bad cough. But having said that, if they need to use it for more than 2 weeks, so they really ought to see the doctor about it just to get themselves checked out. But what we're talking about is regular users of this particular product, dextromethorphan. All right, anything with that in it, okay, this generally tends to be found in dry cough syrups. You really ought to sort of think, well, does this person really need it on a regular basis? And obviously, you've got other products, things like Forcadine and codeine, which can sort of go in the codeine-based products here as well. Thing with this one here, you need to bear in mind. Thirdly, you have sedative antihistamines, and these are products that, as the name suggests, make you drowsy. All different types around. There's things like Nitol, there's Phenergan, there's Nurse. These products tend to contain something called diphenhydramine. Okay, this is Phenergan contains something else called promethazine, but this one here is diphenhydramine, which you can find in Nitol. Anything again, if they used to use it on a regular basis, your alarm bells again should be ringing. Third, you've got the decongestants. Now, in particular, is the cephedrine. Now, the reason why a decongestant is potentially abusable, and this is you wouldn't normally think of it as abusable, really, isn't it? It's because you can quite easily chemically convert this into amphetamine, which can then be used, which is basically a Schedule 2 controlled drug. So this type of drug, again, anything with pseudoephedrine in it, especially, need to bear in mind. And discussed earlier, we're looking at things like the laxatives. Okay, so all laxatives. Senna, we're looking at Dulcolax, we're looking at glycerol suppositories, anything with lactose, anything at all that is used as a laxative, your alarm bell should be ringing if they're using it on a regular basis again. So the paper, as I said, is a really, really good one. I would definitely recommend that you have a read through this. Read through the whole thing. I think it's about 20 pages or something daft like that. You can see it here. But what I really suggest is that you read this bit here, at least. That way, it will give you a very brief overview as to what this paper contains. In actual, when you read this paper, this particular issue with abusable medication is quite common in a number of different countries. So don't think about the fact that it only affects here. It's quite apparent if you read this here that it affects a number of different countries. So we're going to be moving on to the last section now. We're doing very well for time. All right, we're 15 minutes in. What do you need to look out for? Right, anybody like this will be ringing. All right, so anybody who has a prior addiction problem. So in other words, using needle exchange programs, patients who may be on methadone collection programs, or patients who are actually drunk or have alcohol issues or known alcohol issues. These sorts of patients, you need to be quite careful when giving these types of medicines. That's a lot. The dangers. Again, according to your policies and according to your SOPs, you should have an idea as to whether or not you are able to sell to teenagers. Generally, I wouldn't recommend selling anybody under the age of 16 unless they've got an adult present. But laxatives is a big issue. Actually, any of these can be a big issue. Okay, particularly, however, laxatives. And the third class of person I would bring in are the regular buyers. So, in other words, patients who come in perhaps every couple of weeks to these different types of medications. Again, your alarm bells should be ringing. So, as a counter assistant, when you suspect somebody is potentially abusing these particular products, the answer to that is that I would refer to the pharmacist. It's their responsibility to ensure that medication is not abused, that it's used appropriately, and if you suspect something like this is happening, have a chat with your pharmacist, and they should then be able to be in a position to intervene the patient and to discuss that patient why they're using that medication so often, or why they need that medication. Sometimes there is a genuine reason behind it. However, I'll probably say at least once every 2 months or so, I get somebody in, I have to intervene in a sale because I believe that person isn't using that medication appropriately. It's not all Mr., but there are people out there who will use that medication as it is not intended. Okay, so that is about as much as I wanted to discuss with you today. Questions that you want to ask. If there are, then feel free to enter it into the text box. Okay, for the moment. Now, before I move on, what I want to do is I want to show you where you can find these mind maps. What we're also going to be doing is we're going to be putting a video of this particular presentation online, so you can watch it later on as well. So what I'm going to do is I'm going to show you where you can find this information now. So if I go into okay, basically the main website. So hopefully it will log on reasonably quickly. We are. So it's logging on. Now here, you've got a number of different resources. Okay, you need to be logged in as a member, by the way, and you can do this because there would normally be a click here to log in section. So you'll need to log in. And what you can do is there's a number of sections here. The one with the mind maps is if you go into training and development and then go into mind maps. And what you'll do is that you've got a whole load of different mind maps there. And we've already preloaded this one on. I'll show you this. The higher OTC medicines. And what you do is just click the download button and it will come up with the map itself. So you can read it at your own leisure. You can print it off if you want to, put it in your pharmacy. Do what you want with that, really. And there's other different types of mind maps here as well from previous webinars and other bits and pieces that we do as well. So you can download that. So, for example, if you want to read a little bit about obesity management, you can download mind map. I think this one's actually a large one. There we go. And it will give you an idea of some of the things you might want to think about when discussing obesity management with patients. Some of the things that you need to think about as well. That's the first thing. Second thing is that if you go into the training and development part of the website, going into training webinars, oops, additional services, here we go, training webinars, past webinars. What it will do is it will give you a link that you log on to that will all the past webinars that we've done in the past. All right, and you can click on various bits and pieces on this. So, for example, if you want to read about danger symptoms of pharmacy, which is very similar to the one that we've been discussing today, you can click on that and you can listen to that in your own time as well. So this will be loaded up there in the next few days or so. So please look out for that. Okay, guys, I'm going to leave it there. I don't think anybody wants to ask any more questions, so I'm going to leave it for now. Have a really good rest of the day, and if you're interested, we are doing another webinar this evening. This will be at about 8:30, and it will be on palliative care, in other words, terminally ill patients with and painkillers as well. So please look out for that too. So have a good day, and I'll speak to you later. Take care now. Bye-bye.